And Paige Bell with DeKalb County Human Services, and I want to say welcome to our Lunch and Learn series. We are excited to bring to you today Ms. Deborah Furtado, Shannon Butler, and Ms. Musette Hill. They will be our dynamic speakers for today, but before the introductions, please remember to put your questions in the Q&A, being that the chat webinar is disabled. Ms. Deborah Furtado is the Human Services Administrator for the Office of Partnerships, External Affairs, and Grants. She has been with the DeKalb County Human Services Department for 5 years. In her current role, she manages external and internal partnerships with various organizations, always keeping focus on improving the quality of life for DeKalb citizens. Her team is currently managing a DOJ federal grant, Community Violence Intervention Plan, coordinating DeKalb's warming centers for the homeless population, managing an intergenerational volunteer tutoring program, providing food pantry and home repair partners, and working with our grants office to manage DeKalb's Human Services Grants Program. Her team worked to ensure DeKalb County is designated as a dementia-friendly county in 2022. Deborah has over 15 years of nonprofit management and corporate experience. She also holds a master's of public administration from the University of Georgia, and is a graduate of DeKalb Leadership. She was also a member of Decatur's Lifelong Community Advisory Board. She now resides in Decatur and is a proud grandma of 2 grandsons who live in Arkansas, and she enjoys working and training with her dog and best buddy, Joey. Also, to introduce Ms. Shannon Butler, LMSW, she is a dedicated and compassionate licensed social worker who works in community violence intervention, also known as CVI, which specializes in working with at-risk youth and families through trauma-informed care, advocacy, and empowerment. With a strong foundation in community outreach, program development, stakeholder collaboration, she has led initiatives to reduce recidivism, promote healing, and foster resilience. Shannon's background includes work in crisis stabilization, launching grassroots programs for underserved populations, and delivering motivational storytelling to inspire change. And last but never least, to introduce Ms. Musette H. Hill, who is the Special Projects Coordinator with DeKalb County Human Services, Office of Partnerships, External Affairs, and Grants. She has dedicated her professional career to serving the community, and in following in her passion, she began her career coordinating services for at-risk youth who suffer from behavioral and mental health diagnosis. Upon earning her master's in public administration, Musette relocated to Atlanta, Georgia to continue ensuring that the youth and their families receive quality mental health care as a utilization director. In 2016, Musette joined the Grants Division as the project manager, and shortly after returned to youth services as the senior coordinator, where she developed signature initiatives and project development opportunities with local 501c3 organizations. Since 2020, Musette has loaned her special skills assisting the Human Services Department task of connecting more than 760,000 DeKalb County, Georgia residents and their families to resources. Musette is a loving wife, mother, caregiver, and board member of the Southern Crescent Pearls Foundation. Also a member of the Psi Alpha Omega chapter of the Alpha Kappa Alpha sorority, she continues to provide services to her local community. I now present to you Ms. Deborah, Musette, and Ms. Shannon.
Good afternoon, everyone. Thank you so much, Paige, for that warm introduction of our team. Shannon, you can go ahead and share your screen. Okay. As Paige mentioned, I am Musette Hill, and I work with our partnerships division. Shannon and I actually will be tag teaming with this presentation for you all today. So please be sure to use, I'm not sure if the chat is available or the Q&A, if you have any questions about what we're going to talk to you about today. So we'll just get started off. Again, we are here to talk about community violence, and the title of our grant that we have received is Community Violence Intervention Plan Initiative. Next slide. So you all may be wondering, what is CVIPI? Well, I'm going to let you know. CVIPI, Community-Based Violence Intervention and Prevention Initiative is a federal initiative that was launched by the Department of Justice in fiscal year 2022. It was designed to support community violence intervention and prevention programs. The goal is to reduce violent crime by funding evidence-based programs that work with the community residents, local government agencies, and other stakeholders. Now, in 2022, our Human Services Department was awarded the first ever of its kind with this grant, and it was a 3-year planning grant, and it was designed to address the following. We are going to focus on community-based evidence solutions. CVIPI prioritized partnerships between residents and local county government and stakeholders. And later in our presentation, Shannon will give you some more specifics as to how we accomplished that successfully here in DeKalb. Another area of focus is evidence-based strategies. This initiative supports programs that have demonstrated effectiveness in reducing violent crime. Shannon's going to also talk about more about that when it comes to Cure Violence Global. Another area of focus was a comprehensive approach. We aim to address complex factors that contribute to violence, including social, economic, and institutional issues, more specifically termed as social determinants of health. And I'm sure Shannon will be able to go in more specifics about that as well. We have targeted interventions. We focused on individuals, areas with high risk of violence, which we will talk about more, and we used a public health approach. Our prior Surgeon General put out a report, I want to say it was June of last year, if I'm not mistaken, where they declared violence as the #1 epidemic that was facing the United States. So that means that we had more people, unfortunately, that were being killed by violent crimes than any other area, including car accidents, infant mortality rates, anything that you can think of that unfortunately will cause someone death. Crime was the #1 cause. And last, partnerships, which is major for our division because, as Paige alluded, we are the partnerships division. We encourage collaborations between various stakeholders. And I'm proud to share that our particular grant, we have over 20 partnerships throughout DeKalb County that have joined forces with us. Next slide, Shannon. Now, you may be wondering, what is the community violence intervention approach? And we have this graphic here, and it details how the violence approach operates. Right now, we are in what is called asset mapping, which is the final phase of our grant, and we will be sharing more information about that as well. But as you can see, we began with stakeholder partnerships. We have everyone on board, including our DA, Solicitor General, the police department. We have a partnership with Georgia State University. We have Emory. We have Grady on board. We also have the Ivy Project, which is our HVIP. I'm sorry, let me explain that with the acronym. That's our hospital violence intervention program, Ivy through Grady. And what we did was we took those partnerships to build capacity for understanding the work of CVIPI. We determined our approach. We had a readiness assessment that was conducted through Cure Violence Global to determine if DeKalb was ready, and DeKalb is ready for this intervention to take place. We introduced some various programs throughout the past 3 years, and we had community engagement. We completed our needs assessment and we're ready to rock and roll. As I mentioned, we are now in the last phase, which is asset mapping, and that will be determined by utilizing various assets. What do we need, what we don't have, what we need to increase upon. And that's how we will build more about this community violence approach. Next slide. And Shannon, I'll turn it over to you to carry on.
Shannon, you're muted.
Sorry, Shannon.
Sorry, guess you guys do want to hear me. Musette, that was wonderful. Thank you so much for all of that wonderful information. So next we have our CVI PI project timeline. One of our project goals, so year 1, year 2, year 3, as Musette explained, this is a 3-year planning grant. So everything has fallen within this timeline. One of our first year, one of our goals was to develop a county-based community-based violence intervention plan by researching and collecting and analyzing data. So we have been able to use that data to look at different crimes and different resources and the social determinants in here in DeKalb County. Second, 1 to 2 year goal has been conducting evidence-based CVI assessments used to develop the county-based violence prevention plan. 2 to 3 year goals would be to conduct our asset mapping, which is what she talked about. Is kind of where the stage that we are in now, to reduce the look at which programs are needed to reduce the violent crime. 1 to 2 year goal was the implementation of the HVIP, the Hospital Violence Interface Prevention Plan, which we now have at Grady and at Emory Hillingdale. So the Ivy Project and over at Emory Hillingdale. The activities we use through these plans have been to complete all required MOUs for each external partner, which has effectively been executed. Academic team works with DPA and DA's office and the GBI to produce reports with summaries that has been effectively executed. And work with Cure Violence Global to conduct assessments with our academic team in DeKalb communities. That has been effectively effectively done as well. And then create our asset mapping report, which we are still doing. I'm going to go to the next slide. So Mizette talked about all of our partners. Our partnerships are growing, and we are super, super excited about these partnerships. If you look at this overall slide, these are all of our partners that community violence intervention currently partners with now. So great, great, great partnerships. We could not do this work without all of these partnerships. So we are super excited to what they bring to the table and how they are able to assist this amazing initiative. Go to the next slide. So current target areas, focus areas. This is one of my favorite slides. So through this project, we have been able to, with the data collection through Georgia State, which is one of the partnerships, we have been able to identify 15 current target focus areas in DeKalb County. And when we say target areas, we are looking at the target areas that have the areas in DeKalb County that have the highest crime rates, specifically aggravated assaults and homicides. Through those target areas, we have been able to work 4 of them specifically, zone in on those 4 areas and look at what is current, what is missing, look at the social determinants of health, right? Because we know that the social determinants, they are the root causes of gun violence. So in these 4 areas, just a quick tidbit, we partnered with Hope Hustlers, and we actually did 6 community events in these 4 target hotspot areas, which was very, very successful. Moving to our next slide, community target area visits. So we partner with Cure Violence Global and Hope Hustlers to go out into the community and hear back from the community on these target area visits. These visits were focused on gaining feedback from the people who reside in the communities, right? Because we know that we can go out and we can do the work, but we wanted to hear from the community what was needed and what were the issues and or solutions, best practices for their target areas. Next slide. So asset mapping. What is asset mapping? It is a participatory approach to identifying a community's strengths and resources. So it focuses on assets rather than deficits, right? What is strong in that community and how do we build from that to prevent violence or to intervene on violence? So we engage residents and stakeholders in building community-driven solutions. Again, we did this in the 4 target hotspots out of the 15. So asset mapping logistical approach. The asset mapping process, we identify the community assets. So we were able to define the focus areas. To do that, we engaged the stakeholders of those target areas. We collected the data. created an asset map, and then mobilized the assets for action to come up. At the end of asset mapping, we'll be able to come up with an action plan. So our goal, our end of year goal, our end of all of this goal is once approved is a Office of Violence Prevention. That is the end goal of the community violence intervention work, is to have the first ever Office of Violence Prevention in DeKalb County. Once approved, it will have to go through our Board of Commission, but once approved, the office will serve as a unit dedicated to reducing violence and promoting safety within a community. The office will work to address the root causes of violence, implement intervention programs, and foster collaborative partnerships to create safer environments. So we have some pretty big goals here, and I am going to swing it over to Deborah, who will finish us off with the bigger picture and kind of wrapping it all up. So over to you, Deborah.
All right, thank you, Shannon, and thank you, Musette. I'm really proud of both of them. And I know when Paige introduced me, really, I'm so glad to have them do the presentation, because it just shows me how much we've learned, how much I've learned from this work, almost now 3 years. And the partners we have, we couldn't have done this without Georgia State, Dr. Topali, who I think is listening, and of course our partners at Emory, Dr. Randy Smith, who's a trauma surgeon there. Big part of why the Ivy program, Interrupting Violence for Youth and Young Adults, is set up. JQ, all of them there at Grady. And then Hope Hustlers. I mean, who I've learned, I had no idea who Hope Hustlers was and what they did 4 years ago. So we've really learned a lot. And as I think Musette said at the beginning, this is a model that's used throughout the country. Point is to reduce violence, treating it as a public health issue. So we see violence as something that can be cured. But how do you cure things? You cure them through finding out what the problem is, where is the problem, and then we look at root cause. And so when you look at the areas that we really had to do the most work, and that was identifying the hotspot areas, as we call them, there are no surprises, I think, for any of us, but some things stand out. Things like along transportation corridors, the fact that we have areas that, people look at social determinants of health, and that's another presentation we could do on that. But Grady looks at that, and the folks in the Ivy program, where people that are affected by gun violence, that come in and are victims of gun violence, usually have other issues. It's the reason why, as I say, it's the disease. It's for things like poverty, but not just poverty. We dig even deeper to look at what are the issues, like the fact that, being food insecure, not having a job, and education and housing and transportation, and all these things that we're finding. So the asset mapping piece of it, where we are in the last phase, is really important, because Shannon did say we want to look and see what resources we have. And we don't use the word weaknesses, but we also look at where are we lacking? Where are we lacking in things like housing? And so we'll be able to come back to our elected officials and say, this is what we need. Even things like lighting in some areas. And you hear the CEO talk about blight and what she's doing around that. But right now, I'll tell you what we are doing. And thanks to the commissioners, Commissioner Ted Terry, who did say to us at one of our meetings, can y'all fly the plane and build it and fly it at the same time? And he was right. We did, because the pilot program that Shannon described went out into the community and looked at what we would be doing if we had an Office of Violence Prevention, and how we would be working with folks and really preventing the violence. And just one story I'll kind of leave you with was Hope Hustlers was at one of our pilot events, and we were in an apartment complex, giving out food, talking to people, having people come in, doing case management. And the kids were playing. A lot of children in some of these areas, even in the apartment complexes, they don't get to play, which is surprising to me. I live in the city of Decatur. Kids play all the time, everywhere. And they were playing, and we had the bouncy houses, and I'll say a scuffle, but it was a fight that broke out. The moms got involved, everyone did. Hope Hustlers was there. The police were called, but Hope Hustlers was able to prevent any type of situation. And so the police came onto the property, and Leonard Dungy, who's the executive director there, was able to tell them that they weren't needed. They could have some food and just kind of chill. But that's what prevention does. we stopped it then, but at the same time, we're finding out what is the root cause. And we're at right now, Shannon's at Redan and McNair High Schools working with the high-risk youth and some really cool stuff that they're doing, but that's what we're focusing on. It's not just, we know that the police do their job and they're a great partner, but at the same time, we have to look at preventing, and we're really focused on preventing aggravated assaults and homicides. Those are our two main focus areas right now. So with that, we'll be finished up with this project soon. Within a few months, we'll have our plan written up and hopefully make a recommendation to set up an Office of Violence Prevention, which we've seen. We did not know this at the beginning. We've seen throughout the country that those that really focus on prevention do have the office set up. So I guess, Paige, we'll turn it over to any questions that anyone has.
So with the number of 760,000 back in 2022 that was given in the introduction, have you ladies noticed an increase in this number with DeKalb residents as far as helping them and connecting them to resources?
And you're asking, are you talking that number being the number of, are you talking about our population?
Residents for, DeKalb.
What was that again, you said?
I think the 760,000 residents, is that what you were referring to, Paige?
Yes, for your introduction, have you noticed an increase in that, or are you guys still
Oh, is
working on?
DeKalb County growing? Oh, yeah, DeKalb County is definitely growing. In addition to the growth, we also have the highest senior growth, and DeKalb County is the most diverse county in the state of Georgia. So DeKalb is growing every single day.
Right. And I have another question here. With everything currently going on in today's events, have you ladies noticed an increase in homelessness, food shortage, or any violence?
Yeah, I'll actually let Shannon answer that. I think the answer to that is yes, but I think we can be more specific, and I'll let Shannon expand in that as a social worker. But I will say that homelessness is an issue. The county's really been working on that. We had a shooting last week at St. Vincent de Paul where two men were arguing over food distribution. It's very sad. And one pulled a gun on the other person, and they were regular patrons there at St. Vincent de Paul. And usually what we find with preventing violence and the cause, and this one I'm going to turn to Shannon, is it's anger management, conflict resolution. We have most of the shootings that we have, gun violence, are at gas stations in DeKalb. So Shannon, do you want to expand on that?
Deborah, you did great. I told you I am going to get you a social work degree one way or another. You did fantastic answering that. Paige, I will say, of course, anytime that you start to see a decrease in resources, you're going to see an increase in crime. And that goes back to addressing the social determinants of health, right? If we can address people's immediate, find a hub, have the Office of Violence Prevention be the hub of addressing the social determinants of health, then we can reduce violence in totality. That's what we tend to see. So absolutely.
And I will say, Paige, to also that person that asked that, I think a concern would be now that we have a decrease in funding happening at the federal level, where programs are being cut, programs that provided services for people in need. Just like we saw with COVID, we saw an increase in aggravated assaults and homicides during COVID. I think everyone remembers, and usually when you see, just like Shannon said, when you see that decrease, right? People lost their jobs. They had nothing. We had people that were totally food insecure. And housing, people were being kicked out, and the government had to put things in place. And now we have these programs that provided these life-saving services being cut. So not only that, the violence prevention programs are being cut too. I mean, we had a tutoring program, and the federal government, DOJ, cut that program as well. So this is real. I think it's a real concern, and it's important for people to understand that I say we can't just jail people. We have to have solutions. And what we're seeing in Washington is really affecting all of us. And you may not see it. My neighbors may not see it where I live in Decatur. They will see it. It will. We're all a community, and that's what we're really focusing on with this. So I don't mean to scare people, but it is alarming to me to see this and to see the issue of homelessness and what's happening too.
Right. And I have one from a Mr. Greg. Not more of a question, but more of appreciation. Just saying, as a DeKalb County resident, I'm super excited about your goal of an OVP in DeKalb. We need it. I look forward to the county supporting this.
And I would say, Greg,
Thank
tell
you.
your commissioners.
Yes,
Tell
thank
your
you.
commissioners, whoever
Yes.
your commissioners are. I know who mine are. I live in Decatur, but and I think that the commissioners are supportive. One thing we're very fortunate is with our CEO who supports this. Not only that, our CEO supports, the nonprofits and what they're doing, but also our commissioners understanding. We present to them on a regular basis. They understand. And they understand that the police do a great job, but our police department having this, it supports the police and the DA and the public defender and everyone, all of them who are partners in this program. And I have to say, I have to give kudos to Grady, because without Randy Smith and Dr. Topali, Dr. Smith, I should say, that both of them are the ones that got us going. Plus Angel Riley in the DA's office, who also introduced me to both of them. They really get it, and Grady is a great asset for us, not just in the metro, but also in our state and nationally in the country. And their program gets really good results where people come in with gunshot wound victims come in, and what they're able to do with Hope Hustlers with the program they have in place is they're able to reduce what they call reentry. So we don't have as many people, and we see that for the DeKalb numbers too, coming back. And that's really critical. They have some of the lowest numbers, which are really good of reentry in the country.
And I'll just, Paige, if you don't mind, I'm gonna go back to one of the questions about the increase in homelessness and violence and stuff, or things that we see. One of my focuses, being in addition to this team as a social worker, has been to really start bringing in different projects and or partners or things to start working on people's mental health and their social emotional well-being and and emotional dysregulation, right? And what does that look like? Because we know that all of those things contribute to violent acts, right? And or increase in crime. And so just briefly, we were awarded another grant through NACHO and the Violence Prevention and Action Team grant. And we've been able to partner with Hope Hustlers and DeKalb Department of Public Health to work in DeKalb County School District with the highest risk youth through their SAFE Center, which is their Student and Family Engagement Centers. And my focus for that grant has been bringing in evidence-based, evidence-informed practices for conflict resolution, anger management, but also to help these children with their emotional regulation, social and emotional delay, right? And so if we can start catching our youth at that age and working on those things and teaching them how to equip them with the tools that they need, and teaching them how to look at conflict or go deal with conflict in a reasonable way without violent crimes, then we are trying to address the root causes early on before they hit the community, hit the adult population, right? The adult community. And so that is something we have been working on and really partnering with making those different partnerships to address that as well. So I joke, but Deborah and Musette knows what it takes to be a social worker, and they have the background, and they know the importance of those things. So we are trying to tackle this from every end over here in DeKalb County.
And I'll just say, Shannon, to that, our director, Damon Scott, he's the one that initially asked me to apply for this grant. He is also, like Shannon, an LMSW, licensed master social worker. And I've said before, the next president needs to be an LMSW, I feel. Very important, not an attorney, but a social worker. We would be so much better off. And I have learned so much because I'm not a social worker. My focus is on government, but I think what's really critical too, and also Shannon said this program, what I'm learning from her and from Musette on what they're doing with the youth, is wonderful. But think about this. mainly, and Shannon, you said, correct me if I'm wrong, but we have mainly Black men 14 to 34 years of age are the number one cause of death is gun violence, not for white men. Guns are a problem. Sure. We live in Georgia. We're not going to be able to change that as much. We may eventually, but so why is that? You know, when my 90-year-old dad says guns are a problem, I said, yeah, but not for everyone. So it's really, when you think about that, that's what's important, is that what we're talking about is exactly that, is that figuring out why is that happening. We just can't have our youth, our young Black men dying like that, or anyone. So it's just important. And what Shannon said about we even did a test with ourselves on regulating the brain and relaxing, and it is just really, really cool. But you think about it, if you get upset with someone, and even if you have a gun, the thought of pulling a gun and shooting that person, you just, that's that regulation, right? And so some people just, you have to go back and really teach it and learn it. Anyways,
Even more
it's
so.
fascinating to me, but we can solve it.
Yeah. Yep.
We can. And Deborah, just to piggyback on what you just shared, and Shannon touched on it in her presentation, when we finalize our asset mapping, we are hoping that those will give us additional tools that we can bring more resources to DeKalb and figure out exactly where the resources are most needed to help eliminate some of the concerns that are happening throughout our neighborhoods. And Shannon, if you can pull the map back up so we can show the constituents that were able to join the call today. Although we have areas of focus that we're focusing on as far as those targeted areas that we have clustered, we know that, as you can see, that crime is everywhere in DeKalb, but it has been centralized in certain areas. And the asset mapping that we will complete will help us to learn exactly why it is happening there, so we can put more services in those areas. Because we touched on homelessness. We touched on food insecurities. So is it the fact that there are no grocery stores there? Or are there no opportunities for them to have access to grocery stores? Do they need transportation? I myself and Deborah, we joined a presentation yesterday on some of the awesome things that MARTA is up and doing here in the county. So hopefully, again, our asset mapping will bring more value to what is needed to assist us once we open up our Office of Violence Prevention to, as Shannon said, eliminate, hopefully, what's going on as far as the crime here in DeKalb.
We said what was interesting in that committee of the whole meeting with the MARTA presentation. I was thinking I probably should have made sure we invited maybe the commissioner staff to this lunch and learn, is that transportation doesn't go really in a lot of the hotspot areas. So that tells you something too, where transportation is a social determinant of health, meaning it's an issue.
Yes.
It's a problem. Where I live, I have access to MARTA because I live in Decatur. I have access to, I always take MARTA to the airport, and I won't think of driving. And then also I can drive my car anywhere, but I live in a place where I can walk too. And it's so accessible to everything. And I think that's really the key. And Leonard, with Hope Hustlers, did take me on a little field trip, drove me around the hotspot areas, just the two of us. It was fascinating to me. And I've lived in DeKalb for years. And I have to say that I saw a lot. Saw some areas that, it was during the day. But you said, I mean, grocery stores, food insecurity is a problem. It's not the main culprit of violent crime, but there's no grocery stores, no Publix. There's a Kroger on Covington Highway, I believe, and one on, I think, Memorial or Glenwood, but that's about it. So it really, when you see it, you can see the difference, and you can see what'll happen when you make these investments. But it's not just throwing money at it. It needs to be very strategic. And that's one reason why we have planning and zoning on our steering committee too. I'm so glad that they're also, almost every department in DeKalb is involved in this violence prevention. And that, as I'm sure that I know Dr. DePauli would say, is what makes us unique, is we're not doing this in a silo. This is involving everyone, and so many internal and external partners.
Are there any additional questions? Because we can go on and on about this. We have been living and breathing this for the past 3 years.
I do have a couple. How do you feel that the community embraces the many programs that you guys provide?
Well, go ahead.
Oh.
Yeah, go ahead, Musette, because
It is
you've been out
amazing.
there.
Yes, and Shannon can jump in as well. The community has been joyed with what we are doing. Initially, we saw this in our readiness assessment when we were going out doing the community visit events, and you saw some of the shots from there. We met the community where they were. We went to a barbershop, we went to a nightclub. We had an event at one of our hospitals, and they came out and they spoke. They told us what they were needing, what their desires would be, how we could assist. We are also partnering with the PALS Police Athletic League. We partnered with them last summer, and we're going to do it again this summer to offer midnight basketball to some of our youth. And if I'm not mistaken, a couple of those youth last summer actually got drafted with full scholarships to go to different community colleges throughout. I want to say maybe a 3-state area, if I'm not incorrect. So the community has definitely supported us in these events, and we want to continue to have the community support because it is your community, and we want to make sure that we're giving you exactly what you need in your communities. Deborah, you have anything else you want to add, or Shannon?
I'm just going to echo, and I will say a bit of plug in for PAL Plus is that midnight basketball. I'm a huge basketball fan anyways. I'm a Warriors fan because I grew up in the Bay Area, so don't hate me for that. But the basketball program at the South DeKalb YMCA in a hotspot is it is really cool to watch. First of all, the basketball is really good. I saw some kids were so tall, but the girls and the boys are all playing. It's, I think, 14 to 19 or 21. Shannon may know that, but I know that, and they also we have speakers come in, speak with them, talk about life skills. Shannon, I think, and Musette did that last year. We'll do it again. We do surveys. We're able to provide the kids with a pair of sneakers last year, which was great. I don't know if we can do that this year, but that was really good. And as Musette said, it really got folks, and we partnered. So it wasn't just, this was CVI, it was juvenile court, PAL Plus, it was our Office of Youth Services. So again, the key thing of what we're doing here is really partnering the community. Every time the community says, kind of like, where you been? They are embracing this because they see it, again, treating violence as a disease and finding the root cause and then finding the solution.
Any more questions, Paige?
I don't see any on the board. No, it looks like you ladies answered a good amount of everyone's questions.
All right, good. Well,
we do hope that that the community understands what a need this is for the county. And that we want to make sure that the services and the resources that we are providing are going to help make a difference in the lives of our youth and our young adults. As Deborah mentioned, sometimes we only think that it's just the kids that are having the issues, but the studies have shown that it's not. It's up to age 34. So we want to give them as much services and resources as possible.
And I do think one thing, so June is Violence Prevention Month, and I saw one of my colleagues sent a email, haven't looked at it just yet, but we had last Saturday, Musette and Shannon were with Hope Hustlers for the Peace Walk that they had. I think one of our commissioners, Commissioner Long Spears, was there, and I think there's another walk, I think this weekend. It is, I think, on Saturday, I believe, Emory Hillendale is sponsoring that walk, so we'll make sure we get the word out about that. I broke my foot, so I will not be doing the walk, but we will, others will be, and we're just going to do more. You'll see more and more, and we're glad to do this and other things during June, and really want to honor, there's so many people, young and of all different ages, who've been killed through gun violence, and this is something that to me is just unacceptable, that we can, and killed and then injured bad, with aggravated assaults, terrible injuries. As I've learned from Dungy, aggravated assaults, actually our homicides have decreased, but our aggravated assaults have increased. And all that means is that Grady's doing a great job. We're saving lives, but people are still being shot, and we just unnecessarily. Shannon?
I want to thank you all for joining us today. You could have been eating lunch somewhere. You could have been anywhere else, but you decided to hop on this call and listen to us and watch our presentation. And so for that, we are very, very grateful for your presence. And we thank you for the partners who are on the call today. We thank you for all of the effortless and heartless work that you continue to do out there. Thank you for the questions. We are excited about this work, as you guys can tell. We are furthering the work in any way that we can be of assistance. Please do not hesitate to reach out and let us know. And we look forward to talking to many of you ongoing. Thank you so much, Paige and Annette, for inviting us to your platform.
Yes, thank you both.
And in closing, and on behalf of our director, Mr. Damon Scott, and our new CEO, Ms. Lorraine Cochran-Johnson, we want to say thank you to our wonderful, amazing ladies for speaking today and our amazing audience. We are happy that you took the time out of your schedules to be with us today. Please continue to look out for our future Lunch and Learn webinars. May everyone enjoy their day. Thank you.
Thank you.